Hi, good morning. Thank you, Melanie, for introducing me, and thank you, Mindray, for having me here this morning. This morning, I'm here to talk with you a little bit about acute and chronic stress and how it can lead to burnout, especially during this difficult time of a global pandemic. I want to give you a few basic tools that you can implement and then also discuss with you a plan that you can start using tomorrow to help avoid burnout and deal with the chronic stress. Many of you, I'm sure, have heard of the analogy that the flight attendant says, put on your face mask before you put on that of your child's. The same is true in healthcare. It's important that you take care of you so you can help take care of your patients and clients. Next, I want to talk a little bit about chronic and work-related stress. Long, non-traditional work hours, fragmented downtime, perfectionism, fear of litigation, lack of support, feelings of powerlessness, loss, grief, limited resources, advancing medical knowledge, changing EMR systems, and administrative tasks. All of these factors can increase your level of stress. Short-lived stress is expected in day-to-day practice, but when stress becomes chronic stress, it will affect your personal wellness and ultimately could lead to burnout. All of you know that cortisol and adrenaline are released during normal, basic biological response to stressful or high-pressure situations. These hormones, though, are meant to be short-lived. However, when you're constantly in this heightened state, chronic stress occurs. And as physicians, you're not immune to the effects of stress. Research has shown that chronic stress can develop major illnesses such as heart disease, obesity, and a weakened immune system. Additionally, it can affect our psychological well-being, causing anxiety, depression, and insomnia. And unfortunately, left unchecked, it can lead to burnout. Now, add in a global pandemic, COVID-19, and the importance of taking care of you is even more important. You now have a surge in care demands, have ongoing risk of infection, equipment challenges or shortages at times, the need to provide more emotional support as patients are often separated from their loved ones. Then there's the unknown of COVID-19, possibly your own separation from your family, and even childcare responsibilities as students are out of school. These additional stressors can be so difficult and can deplete the healthcare professionals' reserves, leading to burnout. If you're here today, you might be feeling some of the physical and emotional effects of chronic stress. Do you find that your energy is depleted at the end of the day? Or are you having a difficult time interacting with your family members when you get home? Do you have trouble doing basic problem-solving tasks at work? Are you feeling anxiety or depression when you think about your work-related stress? If so, you aren't alone. Rough estimations of physician burnout vary, but it's estimated that about 50% of physicians are currently experiencing some symptoms of burnout. Physician burnout does not happen because there's something wrong with you. This is a difficult career, and the system has not been responsive to the needs of physicians. Systemic changes need to be made to support physicians and other healthcare workers. My focus today, though, will be on small steps you can take to make a big impact on your physical and mental health. So the three main symptoms of burnout are emotional exhaustion, cynicism or detachment, and a loss of satisfaction with one's work. This looks like, so let's say you're emotionally exhausted. You might come home every day psychologically and physically drained, almost like a battery out of power. You might have difficulty responding to normal, mundane tasks of everyday life, like a kid's tantrum, or a flat tire, or a burnt meal. Those might just feel like too much. Often you feel like you've invested too much energy into taking care of your patients and worrying about their problems, as well as dealing with other work-related issues, that you just have nothing left to give at the end of the day. Depersonalization is the second sign of burnout. Physicians experience depersonalization, then often view their patients as things or objects rather than human beings. It's easy to feel like they're just checking patients off a list. Some physicians describe this as kind of a robotic-like feeling, or even like they're acting, like they're in a role that doesn't feel authentic to them. They're cognitively with the patient, but emotionally they feel absent. The last sign of burnout is a lack of satisfaction in your work. So you might feel like you've lost your joy or your meaning that you had as a physician when you first started to practice. You don't just connect with your purpose anymore. Physicians have said at this point they almost often dread going into work. I know this all sounds pretty bleak, and the system is not doing a great job supporting physicians, and they need to do that. But you can also do some basic things to take care of yourself and find ways to reconnect to your purpose and take care of your physical and mental health. There's a lot of hope that even small changes can have a big impact. Next, we're going to move into your burnout busting toolbox. You'll notice that I have it set up into 4 sections: self-care, connection, reflection, and physical and mental and emotional relaxation. I want you, when we're going through each of these 4 areas, to jot down at least one thing that you think you can do based on the tools that I discuss with you in order to start moving towards burning stress and busting burnout. I'm going to start with self-care. All of you probably know more about self-care than I do, and it's pretty basic, but it's a lot easier to talk about self-care than it is to actually do it. It's important for all of us to get an adequate amount of sleep, to exercise regularly, and to maintain a healthy diet. Unfortunately, as we get more and more stressed and have less and less time, self-care tends to go by the wayside. I want you to think for a minute about your sleep, your exercise, and your nutrition habits right now. Are you getting between 7 and 9 hours of sleep? Do you go to sleep and wake up roughly at the same time every day, including weekends? Do you eat food that's a variety of colors? Do you try to stay away from processed foods high in sugar and sodium? Do you get enough fiber and healthy fats? Are you drinking enough water throughout your day? Do you get regular exercise? I can tell you that my answer to most of these questions is no. It feels difficult and even daunting sometimes to focus on the basics of self-care when we have little time and are exhausted. But I want you to think about how you answered the questions I posed. I want you to pick one of these areas and make a note to yourself of a step that you can take and do every day to improve the area of self-care. Are you going to prep one meal a day? Or make a conscious effort to choose healthier items when you're eating at the cafeteria or eating out? Are you going to make a healthy sleep schedule? Are you going to commit to a morning walk or an evening Zumba class? My goal, as I look at this, is to drink more water, as I notice this drastically improves my energy level, it makes me feel less likely to eat junk food, and it helps prevent headaches that I seem to get regularly. Now I want to move on to connection and talking a little bit about the importance of connecting with those that we love during this difficult time, and also connecting with coworkers, especially for a shared experience. We all need a break from our job, and we need to focus on our energy on other things, on people that we're close to, things that are fun for us, and all of that can make a huge impact. I like to talk a little bit about kind of energy depletion and energy deposits. A lot of times when we're under chronic stress, especially during this pandemic, our energy is being depleted during the day at work. We make energy deposits by taking care of ourselves, by doing the basic self-care that I talked about, and by maintaining healthy relationships with the people that you love, so your friends, your immediate family. Recharging here is essential if you're going to have the energy necessary to be emotionally available for your patients and your coworkers. It's important for us to laugh and to have fun and connect to the things that we find enjoyable. If you're away from your family and friends, try to maintain connection using Zoom or FaceTime. And it's also important that you find colleagues that you can connect with. Find somebody who you can be a check-in buddy with. Give and receive support from them so you can avoid isolation, fear, and anxiety. Talk with each other and monitor each other's stress, workload, and safety. I want you to think now about one relationship that you've been feeling that you want to pay more attention to lately. Someone that you'd like to connect with, or that it's been too long. It might be your mom, your dad, your spouse, a friend, one of your kids. I want you to grab your calendar or grab a piece of paper right now and schedule a date for sometime in the next 2 weeks when you can spend some time with them, even if it's just 15 minutes on the phone or on Zoom or on FaceTime. And I want you to show up and see how that feels. The next section of our toolbox is on reflection. And I'm going to spend a little bit more time on reflection than I did on the last two areas. I think reflection is so important because it's connecting back to the why, to why we became passionate about being physicians, to why we do our job, what's important in our job. Connecting to that can really bring us a lot more energy and make us feel good about our job again. Sometimes it's difficult to remember the why when we're feeling exhausted, depleted, or overwhelmed. Rediscovering the why and reminding ourselves daily how our work connects to that why is so important. I want you to take some time to clarify or rediscover your why. I want you to ask yourself these questions now. In what parts of my work do I feel the most fulfilled? What am I really good at in my job? What's most important to me in my work? And what type of impact do I want to have through my work? And why is it important for me to have that impact? Think about those questions for a few seconds. Based on those answers, how can you remind yourself of your why daily? Some physicians tell me they keep thank you notes or pictures that their patients send to them. My personal example as a mental health professional was to keep any email, card, or a reflection that a student wrote about their experience in my program. I would write down the quotes that students wrote that they used during our graduation ceremony to remind myself that I was helping students on their journey. I also would write gratitude notes to myself, reminding me how lucky I am to work with these strong, resilient, and hardworking young people. These students could have easily given up on school, and some of them easily given up on life. I put these in a jar, and I have it in my office. And when I'm having a bad day or when I'm feeling extra stressed out, I pull these notes out and read them. Another way that we can connect to our why and start our day aligned with where we want to go and what we want to do and finding that purpose and meaning is by doing a morning journaling activity. For this journaling activity, you can write in an actual journal. You can use an app on your phone, and there's some great apps that you can use. Or you can just think about the answers to some questions that can help provide clarity and a renewed connection to your purpose and meaning. Journaling really starts my day on a positive and grateful note, and it can help you make sure that you have intentions for your day and even make you more productive. You can ask yourself or say to yourself, I'm grateful for. What will I do to make today great? And today I will brighten someone's day by, and you can actually put who the person is. The apps that are really good are Reflectly, which is a self-care journal. The 5-minute journal is nice, and so is the 5 minutes of gratitude. Another morning activity can be just thinking about an activity or an interaction at work that has brought you joy or brought you connection to meaning. I want you to go into the day, if you do this, with intentionality to experience that experience again. So to find that joy again in that connection. And right now I want you to write down or make note of one way that you can reconnect with your purpose or your meaning daily. Next, I'm going to move into our last part of the toolkit, and this is my favorite part. This is about mental and physical relaxation. We're going to start first with mindfulness and meditation, and then we're going to move into some progressive muscle relaxation. Out of all the research I looked at, it looks like that physical and mental relaxation is the most helpful when you're dealing with chronic and acute stress. Mindfulness-based interventions have gained considerable popularity in practice and in research since the 1980s. Numerous studies and accounts have documented its social, health, and workplace benefits in both clinical and non-clinical students and populations. The benefits of mindfulness have been identified as stress reduction, reduced rumination, decreased negative affect, so depression and anxiety, less emotional reactivity and more effective emotion regulation, increased focus, more cognitive flexibility, and improved working memory. So what is mindfulness? Our minds are really good at shuffling between the past and the future, often driven by our fears and desires and our memories and imagination. Our minds habitually go from reflecting on the past one moment to worrying about the future the next moment, with very little time actually being spent on the fully present moment. So mindfulness is the practice of filling our minds with the present, moment by moment. Meditation is learning to observe those thoughts without judgment. I have 2 mindfulness activities that I want to talk about with you today. The first is a 5-4-3-2-1 sensory grounding experience. This mindfulness activity can help you cope with internal stress by focusing the attention on your external environment. When you're feeling kind of extra stressed or kind of chaotic or out of control, this is a great grounding exercise. So basically what you do is you look around your environment and you name 5 things that you can see and you describe them. Then 4 things that you can touch and describe them. 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This exercise brings you into the moment. It takes you out of your head, and it really helps you be fully present. The other activity is called do one thing at a time. Basically, you just pick an activity that you do every day. So I'm going to say brushing my teeth. And this helps you get used to the experience of being fully in the moment and fully observing what's happening. So with brushing my teeth, I might notice how the toothpaste tastes. I might notice how the bristles feel on my teeth and on my gums and on my tongue. I might pay attention to the temperature of the water in my mouth. How does the toothbrush feel in my hand? If I'm looking in the mirror, I might notice how my hand is moving the toothbrush in my mouth. Once you pick an activity, do it every day for a couple weeks and really try to do mindfulness with it. Then you can use that practice to be mindful in other moments as well. I want you to think about now and write down 1 step you can take towards being more mindful. And notice that if you want to build a practice in mindfulness, if this is something that works for you, there's some great apps out there. Headspace and Calm are both really good. You could do yoga, which includes meditation and mindfulness, or you could even join a meditation center. I'm now going to move into progressive muscle relaxation and relaxing both our mind and our body. There's an activity on here called color breathing, and breathing exercises can really help relax both your mind and your body. I'm not going to go into the details of this one, but if you want to Google or just look up breathing exercises, there's a lot of good ones out there. I'm going to move though on to progressive muscle relaxation. This is my absolutely favorite way to relax daily. And I often do this in the middle of the day if I can. So if I can do it on my lunch break, I try to. If not, I'll do it sometime at the end of the day to just relax before I go home. This is really, really good at relaxing both your mind and your body. Today I'm going to actually have you do a progressive muscle relaxation exercise with me. I think it's really important as I'm doing a workshop on stress busting, both chronic and acute, that I actually use this time to give you an experience where you can relax. That way, as you move about your day and move into your week, you kind of have this memory of this progressive muscle relaxation and you can try it again. So progressive muscle relaxation reduces stress and anxiety in our body by having us slowly tense and relax our muscles. So this can provide an immediate feeling of relaxation. And if you do it every day, it'll help with overall relaxation. I'm going to have you get in a position that feels comfortable for you right now. If you're alone, you can lay down if you want, or you can just sit. And I want you to shut your eyes if you feel comfortable doing so. Begin by taking a deep breath. And notice the feeling of air filling your lungs. Hold your breath for a few seconds. Now release that breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Now move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold on to that tension and notice what it feels like. Release the tension in your foot and notice the new feeling of relaxation. Now begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to that feeling of tension. And release that tension from your lower legs. Again, notice the feeling of relaxation. Remember to keep taking nice, calm, deep breaths. Now tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel the tenseness without going to the point of strain. And release. Feel the tension leave your muscles. Begin to tense your stomach and your chest. You can do this by sucking your stomach in. Squeeze harder and hold the tension. And a little bit longer. And release that tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly. Notice the air fill your lungs and hold it. And release the air slowly, feeling it leave your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Make it feel like you're almost trying to touch your shoulder blades. Hold them tightly. Tense them as hard as you can without straining. And relax. Feel that tension slowly leaving your body, and there's a new feeling of relaxation replacing it. Now tense your arms all the way from your hands to your shoulders. Make a fist and squeeze it all the way up your arm, and hold it. Release that tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. Move up to your neck and head last. Smile as big as you can and raise your eyebrows. And now release that tension. Again, notice the new feeling of relaxation. Finally, tense your entire body. Tense your feet, legs, stomach, chest, arms, head, and neck. Tense harder without straining. Hold that tension. Now release and allow your whole body to go limp. Pay attention to that feeling of relaxation. Slowly wake your body up by moving your muscles. Adjust your arm and legs. Stretch your muscles. And open your eyes when you're ready. There are many progressive muscle relaxation scripts that you can find just by Googling them. And there's auditory ones that you can listen to. But as you get more and more comfortable doing progressive muscle relaxation, you can do it yourself. What's nice about this is you can kind of do it anywhere at any time, and it only takes about 5 minutes. There are other ways that you can relax as well. Yoga, stretching, and massage are all great activities for physical and mental relaxation. I want us to go back to our toolkit now. Looking at the 4 areas, self-care, connection, reflection, and physical and mental relaxation, I want you to write down one thing or think about one thing that you can do in each of these areas to help decrease your stress levels. Be kind to yourself. You all are doing an amazing job. You're in a really, really tough field at a really difficult time. So be kind to yourself. Focus on yourself and give yourself the same attention that you give some of your clients and patients. If you notice yourself starting to have some of the signs of burnout, if you're starting to feel depressed, if you're not enjoying things that you used to enjoy, if you notice yourself thinking about wanting to go to sleep and not wake up, or actually having thoughts of suicide, please get help. there is help out there. There's a really good physician support line that you can call. You can talk to your employer's EAP program if you have one, or talk with your insurance company about finding a counselor. You can call the National Suicide Prevention Lifeline. You can talk to your supervisor, human resources, or a coworker, but please get help. And here are my references. And I just want to thank all of you for being here with me this morning. I really appreciate your time, and I hope that you've learned at least one tool that you can take home with you today and maybe put into practice. Thank you, and have a nice day.